Hey, Hardy, good afternoon to everyone here on this bright, sunny, and somewhat warm Saturday, February 28th, 2026. Hopefully, the early dawn of springtime. This is your resident Social Security disability attorney, Andrew Sendler, saying, I have missed you all. It has been quite some time since my last video, and I apologize immensely for that. It has been a long time coming. Been a lot of stuff, both work and life stuff, good stuff pretty much all around, but just a lot that's sort of taken some time away and I don't want to say derailed me, but definitely caused a little bit of delays on things I wanted to get done at certain times, and this being chief among them. So I missed you all. I wanted to do one that was nice and bright and sunshiny, at least looking during the day. I didn't even want to fool with my backlight, which drives me crazy. So that's why I'm doing it when I have plenty of natural light to come in and shine a little bit of a beacon on this glorious thing that we call life. So enough getting too philosophical or faith-based. But I'm very happy to see everybody and have them see me, I guess, just the same. A lot of good things on the horizon, a lot of the good developments in the Social Security world, and hopefully more to come. So, let me give you a tiny preview. Today's video, which will probably be a little bit on the shorter side, which is good, but on a very specific, focused, relevant, and crucial topic, I think. Some of what I'm going to talk about is a little bit related to some of the topics in the most recent video I did before this, which was, if for those of you who may recall, and it's here on the channel, um, the video about the difference between disabling and debilitating and not having to make yourself completely an invalid in order to qualify for disability. So this speaks to something a little bit similar and it's sort of a branch off of that, but it's also something extremely relatable for a lot of claims. So for those of you watching who are either already going through a claim or looking to get one started or just trying to get some background information to see what your options might be down the line, I'm quite certain there's going to be aspects of this that'll be relatable to you. Even people that are fully capable of working full time, you're going to see some aspects in this video, I'm sure, that are definitely going to be very relatable. And there's some frustrating aspects of what I'm going to talk about, which you'll understand when I get to them. But let's get right to it. Without further ado, let me do my patented screen share so I can get to our PowerPoint for today. Let's begin this slideshow. All right, today's topic will be what a pain. First pain is that my screen window is in the way. Pain, impairments, and disability. So we're going to talk about um, what role pain as a concept, as a symptom, as a limitation plays in the disability world. All right, as always, looks like I'm going to be going back and forth quite a bit here. This is my About Me screen. Nothing has ever changed on this one. Web address, phone number, email, background on my practice, all that good stuff. Yeah, nothing has changed in this realm. If anything, I'm busier now than I've ever been, but I'm enjoying every minute of it and loving getting to help people like the fine folks watching these videos and getting good, important information from them. All right, now the next two slides are actually I'm not going to say I'm plagiarizing myself, but these are pretty much the same slides that started my last video, but the topics will relate to what we're talking about today. So this is just a quick refresher. We'll get through these pretty quickly. So disability, again, is defined and premised on a person's ability or inability to work a full-time job consistently. How you go about proving this, the five-step sequential evaluation process, again, in my original ABCs of SSD video. Again, proving you have no ability to consistently work a full-time job. Disability from working. Again, steps 4 and 5 of the sequential evaluation process are the ones that matter the most because that's how disability is established. At step 4, you establish you can't do your past relevant work, and at step 5, you establish there's no other full-time work you can do on a consistent basis. Disability, again, is about consistency. I can't highlight or emphasize that enough because that is such a crucial concept. Comes up repeatedly, comes up during claims, during hearings, on appeals at the federal court level, you name it. But if you can't consistently work a full-time job, you're disabled. And you have to show consistency of why you can't consistently work a full-time job in your evidence. All right, now we're going to start to diverge into what today's video is actually about. So, impairments and the signs and symptoms of impairments. Because as I've said in prior videos, the impairments and the diagnoses themselves are not what's most relevant and crucial. It's how you experience those impairments in the way of signs, symptoms, and limitations. So many people who have severe medical impairments, again, have clearly related signs and symptoms, and many of which the average person is very familiar with what should accompany any given impairment. The most common symptom for physical impairments is, without a shadow of a doubt, pain. And pain is something we all know all too well from the earliest of ages that we can physically remember. Many types of physical impairments cause a level of pain in one or more parts of or regions of the body. Here are just some common examples, at least as we see them in Social Security claims, certainly not an exhaustive list. Spine impairments, one of the biggest ones, probably arguably the most popular one. So anything that comes under the rubric of degenerative disc disease of the cervical, neck, thoracic, mid-back, and lumbar lower back spines. And this can include anything, we use a lot of terms interchangeably with disc problems, particularly herniated disc, slip disc, bulging disc, tears, annular tears, radiculopathy, neuropathy, things like that, all kind of come under that rubric. Arthritic conditions, so any kind of arthritis itself in any part of the body, or sometimes referred to as degenerative joint disease. It could be the shoulders, it could be the elbows, the knees, the hips, the ankles, the feet, torn tendons, torn ligaments. Fibromyalgia, which is a big one, and there's probably going to come a time where I devote a single video to fibromyalgia itself. But it's a medical diagnosis. A lot of people have it or have remnants of it, and it's becoming more widely accepted and more widely understood, which is important too. Migraines, another one that I will probably equally spend. I may actually combine fibromyalgia and migraines to a certain degree in a future video because I think they do deserve a little bit of spotlight, sadly. Um, and then internal digestive type impairments like gastritis or IBS, for example. And again, there's other examples too, but those are some of the most prominent and most recurring ones that we see in the disability world. Impairment signs and symptoms continued. Pain is a largely subjective symptom, as you all very well know. So basically, that means pain can rarely be seen or measured on any type of objective test. You don't typically go get scanned and you see a dot that says, oh, there's your pain. It's not the way it typically works. So pain is something you know, you feel, you experience. It's extremely subjective because you know what it feels like for you. And everyone experiences it differently, and it's not like anyone can tell the other person what pain's supposed to feel like because it's unique to you. Likewise, causes of pain, underlying causes, can sometimes, but not always, be seen or measured on any objective testing. For example, a disc problem in the back can typically be seen on an imaging study like an MRI, sometimes even occasionally on an X-ray. You can see a tumor on a nerve root that might be compressing and causing pain, particularly the radiating kind that goes down an arm or a leg, and things like that. But you'd be surprised how often an underlying cause, if there is one even, because a lot of times there isn't a clear underlying cause, or the underlying cause itself, again, can't be seen on imaging or any other kind of testing. That doesn't mean it's not there. It doesn't mean it's not valid or legitimate. Pain comes in many shapes, sizes, frequencies, and levels. Just to kind of go over some relevant ones here, often both in the context of medical treatment by doctors as well as in the Social Security world. particularly in any types of forms or questioning. You're asked to rate your pain on a typical 1 to 10 scale, 1 being very mild, 10 being very severe and excruciating, like typically the type that would take you to the doctor or the ER if it's that bad. Um, we oftentimes use descriptors to qualify the type of pain. Is it a dull pain? Is it an aching pain? Is it a shooting, stabbing, burning pain? Stuff like that. Um, this is the way we typically quantify the pain. Those are more about the quality of the pain. Pain, like many other types of symptoms and many other types of impairments, may not be consistent or chronic. You can have, quote, good pain days where you're either having little or no pain. You can have really bad pain days that you're out for the count, sometimes again to the excruciating point of having to go to an ER or a doctor. Um, but keep this very important fact in mind. Pain, no matter how frequent or severe, is extremely distracting. And you may not even realize how distracting it is, but trust me. And I'm gonna just share some personal anecdotes that I tell clients all the time. I make these arguments before judges and hearings. I make them in federal court as well, just about that very bullet point. But I'm going to hold off on that for just a minute. So, why is having pain such a pain? And I've got a few more puns coming up. I'll warn everybody. So you might get a chuckle here and there. I'm just trying to keep it a little bit light. So the most obvious answer, because everyone has pain. Everyone at some point in their life, I guarantee you, no matter what, is going to experience some level and degree of pain from some cause in some region of their body in some fashion. So because everyone has pain, wouldn't everyone theoretically be able to work through it as many people do? Or on the flip side of that, wouldn't everyone not be able to work through it and then everyone would be on disability? From early in life, we learn to recognize what pain looks and feels like. We learn how to treat it, typically with medicine, sometimes with other types of specific treatments, some less invasive than others. And at times, we also learn early in life to compartmentalize it, just shove it under the rug, tough it up. Nope, inadvertently went backwards. Many of us suffer, and I use the word suffer because that's the way I look at it, from quote tough guy slash tough gal syndrome. I can deal with the pain. I'm just gonna go about my day and work through it. It doesn't bother me in the slightest, or even if it does, I'm just gonna tough this out. Pain is rarely ever documented properly or adequately by your doctors. That's the one that I think is the biggest pain of why having pain is such a pain. And why is that? First, and I've lamented about this in other videos, but I'll say it again. Most medical records nowadays, especially with technology and these bigger volume practices, um, are copy and paste notes from one visit to the next. So no matter what you may tell the doctor or the doctor's staff, nurses, whoever, um, you're not typically going to see the detailed notes of what you may have brought in, and particularly if you're not perceiving anything changing from visit to visit. You rarely go to the doctor when you're exhibiting your worst levels of pain, and your records don't reflect your frequency of pain when you're not at the doctor, which is the vast majority of the time. Even if you go to the doctor regularly for whatever your underlying impairment that's causing the pain is, usually you're going when you're having going back to the other slide, one of your good pain days, and you're not typically dealing with the worst of it. And you may not even in that moment be thinking about how bad it is when you're experiencing the worst of it. So that's not going to be reflected in your medical records. Notes, and even sometimes, or actually, I shouldn't say sometimes, a lot of the times, testing or imaging studies rarely portray any significant cause or finding of pain. So most times, particularly on testing like MRIs or CAT scans, and certainly X-rays, you see descriptors that typically look less severe just by the wording and by the nature of the word. So you see words like mild or minimal or moderate. And it doesn't necessarily portray what you're actually dealing with or how frequently you're dealing with it, but it's basically just a way of saying your back's not in danger of splitting open. Your spine's not in danger of separating out like this. So doctors don't hit the alarm buttons unless you're in a true life or death emergency situation. So that's typically why you're seeing those types of descriptors. It's not to say you can't see words like severe or marked, because we do see those from time to time, but these are typically the ones. Most physical exams also typically show, quote, normal or negative findings. You're in a doctor's exam room for a very brief period of time on a doctor's visit. And what you're being asked to do in the confines of a tiny, cramped exam room is not going to be an adequate depiction of what you deal with. So, for example, if you have some kind of severe back, leg, or knee pain or hip pain, and you typically have difficulty standing or walking for long periods of time. But in the confines of a 1 or 2 minute exam where you get off the exam table and the doctor asks you to stand, maybe bend forward, maybe try to stand on one foot, maybe try to hop, maybe try to walk on your ankle or on your heels or your toes within the short, tiny distance of an actual exam room and not walking down like a long hallway or corridor or anything like that. 99 times out of 100, you're going to be able to do those things, especially if you're not having a bad pain day. So, of course, the doctors are going to put notes like normal gait or negative as far as gait instability or balance problems. So, what can and should you do to alleviate the pain of alleging pain? Good question. One that comes up quite frequently in my practice. First and foremost, I have this all caps for a reason because it is so important. Take your pain seriously and don't downplay it or allow it to become something you, quote, learn to live with. I can't tell you how many clients of mine over the years, particularly in the context of a hearing with a judge that's going to decide their fate, make comments just like that, whether they use those exact words or something pretty darn close to it. And I know that's the way they feel because they've had pain for such a long period of time, for so many years or however long it's been, that it just has become like a part of their life. Like they don't even notice it like that. They feel it, but they just don't notice it because it's so constant. And when they make comments like I learned to live with it or it doesn't stop me from getting through my day, that's one of the quickest and easiest ways to tank a claim before it even gets off the ground. Second, and this is something I've been for the last several years. It's not something I used to think of, even though it was actually a boilerplate instruction in my introduction letters when I first signed up a new client. Keep a log or a diary to track, highlight, and emphasize the pain, especially on your bad days or moments, and note in detail the exact difficulties or limitations you experience when you have pain, how often, how severe, how it limits you, etc. So I'll come back to the example I gave before, or the example that I said I was going to highlight now. So I don't have any major, knock wood, ongoing impairments that I've been diagnosed with that cause any ongoing type of pain. I did actually, when I was in my mid 20s, I had a recurring low back herniated disc that MRI confirmed, and it wasn't from any specific cause or trauma. It was basically a long time of driving low to the ground in a very uncomfortable car, sports car, and it finally took its toll on me after a while. And I remember what that did to me. But that's been many years removed from where I am now. Knock wood, I don't have those kind of problems. But that doesn't mean I don't experience pain from different things randomly. And one of the most common ones that I'll say, even though I don't have any underlying diagnosis that I'm aware of that would cause it, is headaches. I think we all deal with headaches as adults and kids too. And I've had some pretty bad ones in recent years, possibly one that I would even say would constitute a true migraine. And I just think of the typical kind of headache. Like I wake up one morning and I suddenly feel like, oh, it must be a bad weather day, or maybe it's just because I didn't get as much sleep or I didn't eat as much the day before, whatever it is. And I immediately know if I don't do something to get out ahead of it, whether it's just taking a quick over-the-counter pain med like Advil or something like that, I know it's going to get to me worse and worse through the day and distract me away from what I need to do. The prospect of holding a conversation on the phone or even just listening to someone who might be talking loud on the other end, staring at my bright computer screen, trying to type, whatever it is, it's not going to fly. And that's me as a full-time able-bodied Social Security disability attorney. On a given day, I may not be able to advocate for my clients. Now, fortunately, being a solo practitioner, I have the ability to say, okay, I may not be at my best today. I may even have to take some time to myself. It's not scheduled, not planned, but I may have no choice. I can get away with something like that because I'm working for myself. The vast majority of you watching this, if you're currently or you have worked for employers, you know that's not realistic. You start getting distracted from your work because you've got headache pain that won't go away just quickly popping Advil or something like that. Or you have to leave early, come in late, call out sick. You do that too frequently, the employer is going to say, nice knowing you. And that's the reality of it. So that's why keeping this log or diary and really describing out, on a weekly or monthly basis, how many days you're having where you have these types of moments, that's going to more readily translate to what kinds of problems will that cause you in the workforce for an employer working any kind of job, no matter how simple or straightforward it is. Third, similar to the second one here, communicate with your doctors and providers when you're having pain outside of your appointments. So one big thing that I've been telling clients for a while is take advantage of these online portals that so many doctors have to send them messages. And those messages automatically become part of your record. They're required to by law. And if you can't use an online portal or the doctor doesn't have one, call the doctor. And even if you don't get the doctor on the phone, leave a message because those messages also by law have to become part of your medical record, and everything will be documented. And then a decision maker like a judge sees even on your actual visits, even if it doesn't show as much going on in the way of pain or symptoms like that, it's still going to show how often you're telling the doctor pain keeps hitting me. Yeah, I'm not in to see you today. It wasn't a scheduled appointment, but hey, look how frequently I'm dealing with this. And most important of all, go to the doctor and ER to address your recurring pain. And every time you do, keep describing it in detail and how it limits you, even if you're not experiencing it at that very moment. Very important. Other considerations not to be a pain. Ha, ha, ha. I told you there were some bad puns in here. As stated in many of my other videos, like the function and work history report and even the consultative exam and the hearing prep videos among them, you always want to lead with when you're dealing with both your doctors and your medical providers, consultative examiners, and of course, judges and other decision makers, all of your symptoms and difficulties and limitations. And that will be the difference again between a win and a loss. When we're talking about pain specifically, there are other questionnaires that actually come up from time to time as part of the claims process. Now, it says let's explore them, but I'm going to show you one such form blank. I'm going to do a different screen share in a second. But basically, the pain questionnaire is a big one that comes up. It's got some similar aspects to the function report. And when any of my clients get it, I tell them to watch the function report video to get an understanding of how they should best fill out this form. And you can see from some of the other titles, headache questionnaire, cardiac questionnaire, seizure questionnaire, they ask similar things in a similar fashion to what you're about to see on the pain questionnaire, but again, specific to those types of impairments. So let me get out of the slideshow for just a minute. And I'm going to change my share now. And this should be able to bring up what I'm trying to share with you. Here it is. Okay. All right. So what you see here is a sample pain questionnaire. And you can see some of the questions that are being asked. Describe where the pain is located. Does it stay in one location or move to other areas of your body? Describe the pain. Again, burning, dull, sharp, aching, the severity, mild, moderate, severe. You can put a numerical value in here. How often do you have it? When does it occur? How long does it last? What activities or circumstances cause or increase the pain? Has the pain limited or restricted your activities? If yes, explain. Does the pain affect your ability to think and concentrate? Like the example I just gave with headaches. I'm sure the overwhelming response from all of you should absolutely be yes, right here. Then the rest of it is just kind of busy work. Name your medications, any side effects, when you started them, which doctor. Do they relieve the pain? Yes or no? Do other treatments help relieve the pain? Hot baths, therapy, exercise, TENS unit, stuff like that. And then they ask you to name doctors that are treating you for it, date of your last visit, and next scheduled visit. And that should give you an idea of what, not only what those questionnaires ask for, because they're far less involved in the function report or work history report, but also it gives you an idea of how you should be describing your pain to doctors or in your own diary notes or logs. So definitely an important one to take advantage of, like I said. All right, let me quickly get us back because we're just about at the end of the PowerPoint, and I do want to finish that up for you guys. All right, and let me resume. Okay, so I think I just have to click back into where we left off. Last thing, case law. There's an abundant amount of it that speaks to not only these types of impairments that cause pain and related symptoms, but actually requires decision makers, judges or whoever, to make, if they're going to find these impairments to be severe, they also need to make appropriate specific findings as to the frequency, the duration, and the severity of these impairments and how they either do or don't lead to time off task and absenteeism from work. So you can't say somebody has migraines as a severe impairment or has degenerative disc disease and not comment on how the pain or other symptoms they're going to experience from that are going to impact their ability to sustain an 8 hour a day, 5 day a week job. It's not realistic. So either you have to say what in the medical evidence speaks to why they will still be able to work full-time work and support it with substantial evidence, or your decision will get overturned and reversed and remanded if you try to get away with it the other way. And I've had many cases on that very basis, particularly with migraines and fibromyalgia, among others, where that's exactly how it's played out. Final thoughts. Don't be a pain, but be a pain. Be a thorn in their side. Make sure they understand what you're dealing with. This is a painstaking process, and you can't back down. No pain, no gain. Last pun, I promise. So I hope you all garnered some good stuff. Sorry, I had to get my last ha 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 in there from this video, and I hope again it's extremely relatable. Once again, with any questions for any of you, phone and email are the best ways to get me. I respond to calls, emails, and texts, and I'm always glad to help in any capacity that I can. But without further ado, that concludes today's video. Again, I'm sorry it's been so long since the last one. I'll try not to stay away as long this time. I have been doing other um, forums to get information out, including a fellow colleague attorney of mine down in Atlanta named Jonathan Ginsburg runs a weekly live stream. It's mostly for his own clients, but I think other people can get on, and I've joined him a couple times as a guest speaker slash correspondent. So we talk a lot on different topics and answer live questions on a live stream chat. I'm going to look into trying to implement something like that at some point soon. But in the meantime, enjoy. Feel free to subscribe to the channel so you know when new videos are posted. And I will look forward to seeing you all on the next one. Take care.